everyone!
I am Glaiza Bunao.
I am Ariela, Gade.
I'm Geraldine Quiroz.
I'm Rico, Naval.
I'm Ericka, Cabrera.
I'm TJ Lane.
I'm Angelika Santos.
I'm Marvin, Paguia.
And we are the Group 4.
Are we going to discuss ADHD?
So, what is ADHD?
ADHD or Attention Deficit Hyperactivity Disorder is one of the most common neurodevelopmental disorder in childhood. It is usually first diagnosed in childhood and often last in adulthood.
Children with ADHD may have trouble paying attention and controlling impulsive behavior or be overly active. What are the causes of ADHD?
According to the researches and studies, the causes or the risk factors of ADHD are still unknown. But in the recent studies, it shows that genetics have an important role.
According to researchers and studies, these are the possible causes and risk factors of ADHD. Number 1 is brain injury. Number 2, exposure to environment during pregnancy and at the young age. Number 3 is alcoholic tobacco during pregnancy and low birth weight and premature delivery. It is normal for children to have trouble focusing and behaving at one time or another.
However, children with ADHD do not just grow out of these behaviors.
The symptoms continue, can be severe, or can cause difficulty at school, at home, or with friends.
These are the signs and symptoms that a child might have an ADHD. First, we have
Daydream a lot,
forget or lose things a lot,
scream and fidget,
talk too much,
make careless mistakes, and take accessories,
have a hard time resisting temptations,
have trouble taking turns,
have a difficulty getting along with others. There are 3 different types of ADHD. The first one is
predominantly inattentive presentation. It is hard for the individual to organize or finish a task, to pay attention to details, or to follow instructions or conversation. The person is easily distracted or forgets details of daily routines.
The second one is predominantly hyperactive impulsive presentation. The person fidgets and talks a lot. It is hard to sit still for long, for a meal or while doing homework. Smaller children may run, jump, or climb constantly. The individual feels restless and has trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things from people, or speak at inappropriate times. It is hard for the person to wait their turn or listen to the directions. A person with impulsiveness may have more accidents and injuries than others.
And the last is combined presentation. Symptoms of the above 2 types are equally present in the person.
So, ayun nga, tapos na tayo i-discuss kung ano yung ibig sabihin ng ADHD. Ngayon, dadako na tayo sa pag-discuss kung ano yung mga estratehiya na gagamitin ng isang teacher kapag naka-encounter siya ng mga estudyante may ganitong disorder.
So, as a teacher, ano yung mga strategies na pwede mong gamitin kapag naka-encounter ka ng ADHD students?
So, marami tayong pwedeng gawin. But before we going to discuss it, i-define muna natin kung ano yung mga characteristic ng mga ADHD students sa loob ng isang classroom. These are the characteristics of ADHD students inside the classroom. First, they demand attention by talking out of turn or moving around the room.
Second, have trouble following instructions, especially when they're presented in a list and with operations that require ordered steps, such as long division or solving equations.
Third is, they often forget to write down homework assignments, do them, or bring completed work to school.
Fourth, often lack fine motor control, which makes note-taking difficult and handwriting a trial to read.
Also, they have problems with the long-term projects where there is no direct supervision.
Last, pull their weight during group work and may even keep a group from accomplishing its task.
So, ayun nga, natapos na natin i-define yung characteristic ng isang estudyante mayroong ADHD disorder sa loob ng classroom. So, ngayon, i-discuss naman namin kung ano yung mga strategies na pwedeng gamitin ng isang guro sa pagtuturo sa kanyang estudyante may gantong disorder. Ang unang kailangan sa alang-alang ng isang guro sa pagtuturo or mga strategy na kailangan niyang gawin sa pagtuturo sa mga estudyante may gantong disorder is, yung una is seating arrangement. Bakit seating arrangement? Kailangan niya isaalang-alang ito dahil ang mga estudyante may gantong disorder ay sobrang malilikot. Kailangan ilayo sila sa upuan na malapit sa bintana o pinto dahil ito ay para sa kanilang kaligtasan. And kailangan nila ilagay ang mga estudyante may gantong disorder katapat nila or nasa harapan nila para mabigyan ng espesyal na atensyon or supervision ang mga batang may gantong klaseng disorder.
So, next strategy is sa information delivery. So, sa information delivery, kailangan meron kang step-by-step process or meron kang detailed na outline and guidelines ng lesson na ituturo mo sa students na may gantong disorder.
So, ayun nga, ang third strategy na pwedeng gamitin ng isang guro sa pagtuturo sa mga estudyante may gantong disorder is about sa student work. Sa student work naman, kailangan isaalang-alang ng isang guro yung capacity ng isang estudyante may gantong disorder. Kailangan niyang bigyan ng extra supervision ito at hindi mo dapat minabadali na isang guro sa pagpasa ng kanyang output ang mga estudyante may gantong disorder. Also, dapat bigyan ng mas maikli or mas konting gawain ang mga estudyante may gantong disorder dahil nga sa nahihirapan sila mag-focus sa isang bagay or sa kanilang mga gagawing activities. So first, starting a lesson. First, signal the start of lesson with an oral cue such as an egg timer or cowbell or a horn. You can use subsequent cues to show how much time remains in a lesson. Also, they establish eye contact with any student who has ADHD and list the activities of the lesson on the board. The teacher also open the lesson and tell the students what they're going to learn and what your expectations are. Tell your student exactly what materials they need. And about conducting the lesson,
So, in conducting the lesson, keep instructions simple and structured. Use props, charts, and other visual aids.
Autism spectrum disorder affects a person's social communication and interaction in any various contexts. There is no cure, but treatment can help make progress in the areas that they find challenging.
And according to the Center for Disease and Control Prevention, or CDC, around 1 in 59 children in the United States are experiencing autism spectrum disorder. Symptoms of autism. Autism was considered as being a spectrum, meaning that the symptoms vary widely from individual to individual. ASD is often stereotyped as Rain Man or more recently Temple Grandin.
While there is no singular presentation or look of autism, individuals with the condition share some common characteristic, although the intensity of this characteristic exists. On a continuum from mild to a very high magnitude, all individuals with ASD have
Restricted and repetitive interests and or movements. For some, this hyperfocus on a narrow range of interests leads to amazing accomplishments. For others, this narrow focus prevents them from participating in activities and interacting within others.
Second, impaired social interaction. This impairment might present as extreme shyness or awkwardness. Other individuals may highly outspoken without concern for how others react to what they say. Some individuals with autism may feel extremely uncomfortable in social situations and prefer to be alone the majority of the time.
These are the strategies the teacher uses in dealing with the student with autism. Number 1. Use simple, concrete language. Simple, concrete language, especially when the word used are in visual nature and accompanied by visual supports. It is easier for students on the spectrum to interpret that abstract or metaphorical language is. Number 2. Give limited, clear choices. For many students with ASD, choosing can become nearly impossible when given a wide range of options to consider. Likewise, choices that have no sense can provide an unwelcome and unwinnable challenge. Because of this reality, it's important that the choices presented to the student are both clear and limited scope. Number 3. Be gentle in criticism. Like all children and adolescents, autistic students need honesty, guidance, and feedback regarding when they are doing tasks correctly and when they are not. But it's important to always be gentle in tone and word when offering correction or critique.
4. Applied Behavior Analysis or ABA. ABA is a systematic approach that assesses and evaluates a student's behavior and applies intervention to try and alter behavior. From understanding a behavior function to controlling the student's environment, ABA has been shown to be successful in shaping students' behavior. Elements of applied behavior analysis include intervention designed by a trained behavior analysis. Next, develop a frequent goal that emphasize achieving greater independence for the student both now and in the future. Next, training for parent and caregivers so ABA can be continued in the home. Lastly, abundant positive reinforcement for desired behaviors. Number 5. Solve sensory problems. Behavior troubles in students with ASD often come from after an experience of sensory discomfort that can include the range of senses, from the hum and pulse of fluorescent light to the whispering that take place as times among other children in the room. Students on the spectrum can struggle with sensory experiences that can impede from participating in a classroom objectives, behaving as desired, and learning. Number 6. Discrete Trial Teaching or DTT, also known as the Lobos model. DTT uses positive reinforcement to focus on changing skill in behaviors by breaking each one down in smaller steps that are taught along with prompts until the student masters the step required to perform particular skill or behavior. DTT may use of 5 primary techniques. Number 1. Identification of component parts of particular skill or behavior. Number 2. Instructing the student in those component parts until each individual part is mastered. Number 3. Intensive training session. Number 4. The use of ROMs early in the intervention and decreasing use of ROMs as the student learns. And lastly, utilization of positive reinforcement to increase retention of component parts and skills.